HepLOGIC pilot and feasibility study is now recruiting. We're looking for 20 general practice clinics to join us in testing a clinical decision support tool for viral hepatitis and liver cancer that is integrated into your patient records. My name is Nicole Allard. I'm a GP with over 20 years of experience, and I'm also an epidemiologist and researcher at the Doherty Institute in Melbourne. Liver cancer is the fastest increasing cause of cancer death in Australia. It has a low survival rate and is a priority cancer nationally. In Australia, we have over 200,000 people living with hepatitis B and about 100,000 people still living with hepatitis C. These and people with fatty liver or alcoholic-related liver disease are at increased risk of liver cancer. Liver cancer is often diagnosed late, meaning that treatment options are limited. Our analysis of Australian data indicates that in the general practice population, less than half of people who are at risk of chronic viral hepatitis have been tested. The HepLOGIC study aims to pilot tools that use information from your practice software to identify people who need screening for hepatitis B or hepatitis C or who are at an increased risk of liver cancer. Walrus is a point-of-care tool that has been developed within the Polar digital data environment. Walrus sits open in front of your clinical software, alerting you to risks that are indicated within an open patient record. In this demonstration, Walrus has identified that this patient is at risk of hepatitis B and has no evidence of testing recorded in the clinical software. Walrus allows you to directly open the pathology order window and order the required tests. It also provides links to further information about the risks or allows testing to be declined. If your practice is in Gippsland, Eastern Melbourne or South East Melbourne primary healthcare network regions, and you use either best practice or medical director clinical software, then you may be eligible to join our study to test the HepLOGIC Walrus tool within your clinical practice.